Hello everyone, Dr. Schroetke here of Physical Therapy and Hand Clinic of Hillsborough with another exciting edition of Technique Tuesday. In a previous video that I did for today's Technique Tuesday, I showed extension and standing, okay, which is I called it a go-to technique or a desert island technique. And now I'm going to show one called extension and lying. So I've mentioned in previous videos that you want to get your joints to end range in order to have a good mechanical response to your pain and to your movement with the technique. For a lot of people, because their range of motion is beyond what you can do here, this isn't going to get you to end range. So this technique might not be working for some of you. So if we bring this technique into lying on our stomachs or prone, it will actually allow us to get to end range. So if this wasn't working for you, this alternative might work better. So it's called extension and lying. This is going to work for back pain, pain that radiates into the buttock, down the leg, or maybe even all the way down the foot, okay? But it's not for everyone, but I would say it is for a lot of people this will help, okay? So you'll start on your stomach. That's the fun part. And what you'll do is you take your hands and you put them right beneath your shoulders, and you're just going to, it's called extension and lying or prone press up. So you're here, and then you just press up as high as you can. Try to lock the elbows. Hold for about 2 seconds. And then back down. Up. All the way, all the way, all the way. Lock the elbows. And back down. Okay? Usually you're going to do anywhere from 10 to 15 reps every 2 to 3 hours, or perhaps even every hour if it's a more severe case. I'm going to do this a couple more times. Go up, up, up. It's important that you lock the elbows. That's almost end range. I'm actually not quite to end range yet. And then back down. When you first start, you might be restricted or you might have some pain, so you might have to only start in this kind of mid-range version, and that's okay, but as time goes, you should be able to get farther and farther and farther, okay? If I want to hit my true end range, so if that's working for you perfectly, then no need to modify it, but if it's not quite working for you, another modification to get to end range is you press up, lock the elbows, and then you exhale. And when you do that, you'll feel your low back sag a lot, and that's getting your joints to end range, which for those of us who need it is going to be a more powerful response for our bodies. So that way, that's called a blow and sag. Yeah. So anyhow, you go up, lock the elbows, exhale, and then down, okay? So extension and lying with blow and sag. Make sure to check with your physician before doing this exercise to make sure it's appropriate for you. Dr. Schroetke here with Technique Tuesday, Physical Therapy and Hand Clinic of Hillsborough. That's a mouthful. All right, thanks.